This is stunning to me.
Yeah.
5 years ago this week marked one of the most impactful changes really in human history, if you break it down. 5 years ago, right now, we were at the front edge of the COVID-19 pandemic here in Cleveland.
Yes, the front edge of shutting down. And people thought, I thought, I'll get a week off.
Sure.
This isn't so bad. Boy, I don't know what I'm talking about. This is the week that Ohio learned. We had our first 3 cases, all from Cuyahoga County. Senior health correspondent Monica Robbins was on the front lines, of course, covering the pandemic from the beginning. She has a look at what has changed from the healthcare perspective because of what happened 5 years ago.
Oh, what a fun time it was.
My
You remember
goodness.
that? Oh, my goodness.
Well, I'd forgotten, what was the saying at the beginning, like a couple of weeks to flatten the curve or whatever?
Yes.
Yeah.
And we thought it would be a few weeks and we'd be back to normal.
We thought.
We thought
it
wrong.
would be. Yeah, we thought wrong. So the COVID pandemic turned our world upside down. A novel virus we'd never seen before. We had no idea what it would do next. No one impacted more than those on the front lines of the COVID floors in hospitals, treating the sickest of the sick, though. Forced to wear stifling protective gear head to toe and take the place of families who could not visit their loved ones. Often, they were the only connection at the very end. It changed many facets of healthcare, streamlined services, redefined teamwork, and redesigned workarounds. Are we ready for another pandemic?
And we don't have that fear. We just don't. I think that we would just instinctively, as an entity, pull together. Nobody taught us what to do last time. We were thrown in kind of, in the fire. And we had to figure it out as we went along. Now we know. And now we have that knowledge behind us, that experience behind us, all the good, all the bad. And I think that we would be ready for whatever came our way.
Tonight at 5, Michelle Brownlee takes a look back 5 years ago at what she experienced on the front lines of the COVID pandemic, what she learned, and what lessons are still being used today. And for many of us, we put the memories of that pandemic behind us, but for some, they're still forced to live with the fallout. We'll take a look at those stories, too, as we remember COVID-19 5 years later this week.
God bless those people in the hospitals.
Yeah,
I
they were
don't know how
heroes.
they did it. They were heroes, and that you can't say that enough.
You mentioned it in your piece. I think of all of the tragedies that came from it, to me, the most heartbreaking were the tens of thousands of families who had to say goodbye to their loved ones through glass windows or over communication devices.
Over iPads.
Couldn't be there for them. It's
And those
tragedy.
nurses and those doctors who were those connections to
Correct.
them, and what they put, what they went through. Everybody seems to forget, that they carry that with them to this day.
They carried the weight of all of us.
Yes, they did.
Mom, thanks. We look forward to your other reports.